there! Welcome to Crash Course, where we tackle big topics in bite-sized episodes. Today we're diving into a fascinating topic, but it's a serious one, botulism. Botulism is an infectious disease that's as sneaky as it is dangerous. Let's talk about what it is, how it works, and the different ways it can impact your body. Ready? Let's go. Let's answer the main question. What is botulism? Botulism is an infectious disease that directly targets your nervous system, specifically all the nerves in your body. What's the culprit? A toxin called Clostridium botulinum. The toxin is like a microscopic villain that disrupts communication between your nerves and the muscles, which leads to muscle and respiratory paralysis. Like in a game of dominoes, Clostridium botulism sets off a chain reaction in your body. In most cases, it begins in your face, and when you begin to lose control of your face, it just begins to go slack. No smiles or frowns, your face is just still. As it is absorbed and transported, when it goes through your mucous lining in the gut and then through the bloodstream, it can slow your breathing, which is why botulism is a medical emergency, because it can lead to death if the paralysis progresses to your lungs. This is a major complication and solidifies the need to get treated quickly when you have been affected. Like I said before, the cause of botulism is the bacteria Clostridium botulinum. And this is either through ingestion, colonization, or infection. And then these different types produces the toxins that causes paralysis. So it can either affect you through spores, which are found in soil and dirt and dust, or it can affect you through toxins, and there are 7 different types, but the only ones that causes diseases in humans are A, B, E, and F. Did you know that there isn't just one type of botulism? There's actually 4 main types of botulism, and these all have similar symptoms. They all come from the same common root as well, which is that Clostridium botulism. And they do sneak into your body in different ways, though. That's what makes these 4 types different. So their names are foodborne, wound, infant, and iatrogenic botulism. There are different modes of transmission, and here they are. So the first one we're going to be talking about is foodborne botulism. This kind of botulism occurs when you eat a food that has been contaminated with the toxin that comes from botulism, the Clostridium botulinum. And so this is the most common type of the disease. It's definitely the one you hear the most about. Before doing this, I didn't know that there was other kinds, because I just thought, it comes from canned or preserved foods. But it doesn't just come from that. But it comes from canned and preserved foods when you don't properly heat and disinfect your canning jars. And it also can come from fermented foods or any non-acidic food when it is stored improperly. Botulism is an anaerobic bacteria, so it does really well in places where there's little to no oxygen. So a closed off jar is an amazing place for this bacteria to grow because it has no oxygen, so it's going to just rapidly grow. And when you eat this contaminated food, you begin to get sick, usually within a 6 to 36 hour period, and these effects can last for as little as a few hours and as long as 10 days. This form of botulism is caused by toxins and not the spores. The next kind of botulism we're going to be talking about is wound botulism. So wound botulism is where an open wound is infected either through dirt or debris. So it's when you don't properly clean a wound and you just let the dirt or debris sit there, it's going to become infected, and the spores that are in the wound botulism infect your body, and so it goes into your bloodstream. It can also happen through injections, if you're using drugs and you aren't cleaning the surface properly, or if you're reusing needles or things like that, it can cause the same wound botulism effects. Another one is infant botulism. So this form of botulism occurs in babies under 1 year old because they don't have the proper immune system to fight off the botulism when it enters their body. It enters their body in like full spores. It typically comes from something like honey, and so it goes into the baby and they can't fight it off. So it has the same effects as it has in like foodborne or wound botulism. It's just a little bit more severe since they don't have any sort of immune system for it. It can also happen in adults, but it's extremely rare. And when it happens in adults, it's not called infant botulism, obviously. It's called intestinal botulism. The fourth main one we're going to talk about is iatrogenic botulism. And so this is a very rare one, but it can happen when you are getting botulinum toxin, either through like cosmetic or like medical injections. So like cosmetic is like if you're getting Botox in your face, or if you're getting Botox in somewhere else for like pain related reasons. It can be either of those. So this one's really rare because you are usually going to an injector that is licensed and knows what they're doing. So they're doing it in a safe practice. But if you are getting like excessive amounts of Botox, or your injector isn't licensed and is giving you too much or something along those lines, it can harm you. So it's less likely than the other ones because you can get Botox safely, but it does happen if you go crazy with it. You're probably wondering, what are the common symptoms between these different kinds of botulism? Well, the common symptoms are having difficulty swallowing or speaking, dry mouth, double or blurred vision, drooping eyelids, and muscle weakness. And these are some of the first ones that can be shown. And if you start to see these symptoms, it's a red flag that it might be botulism, and it could be more serious if you don't take care of it. Some other symptoms are gastrointestinal symptoms. The ones we just talked about were neurological, but gastrointestinal symptoms are the ones you see in foodborne botulism. This is usually what people think of when they think of botulism. It's the nausea, vomiting, and stomach cramps. These are also early signs of botulism. So if you are having the neurological and the gastrointestinal symptoms, it's definitely a good idea to go see a doctor, because it's better to be safe than sorry in this situation. Not being safe could lead to muscle paralysis and respiratory paralysis, which could be fatal, so definitely be cautious. So at the microscopic level, botulism is a gram-positive and rod-shaped bacteria. It also forms endospores, and so these are the oval-shaped protectors that give the bacteria a tennis racket appearance when you're looking at it at a microscopic level. It is also an anaerobic organism, so this means that it does best in situations where there is no oxygen. It also exists in two main forms, and we've talked about both of them already, but they are the toxins, which is going to be in a vegetative cell, so it's active and it's actively producing toxins. And then there's also the spores, which are going to be dormant, and they're highly resistant to extreme environmental conditions, so they are long lasters, and they just stick around. Also at the microscopic level, we can look at how botulism affects the host cells and the tissues when it invades the host body. So when we are looking at it at a microscopic level, the tissue is going to appear limp, with little to no tone, because it is lacking in the stimulation it needs from the motor neurons. So you can see this best in skeletal and respiratory muscles because the muscle fibers appear atrophied because of how long they've been inactive. If you look at the nerve cells under a microscope, you could see an accumulation of vesicles, and since they cannot complete their job of docking and releasing contents into the cell, they're just locked up there, and they're all just like staying where they were originally, even though they're trying to leave, but they can't They are unable to do this because of the paralysis that has occurred in the nervous system. So they're completely shocked and it's just not able to function properly. So the physiological mechanisms that allow for this disease creation is a multi-step process. We've already covered how the toxin passes through your gut and then into your bloodstream. But the next step is that it's going to do neuromuscular junction targeting. So this means that it is going to target cells. This is the mode of transmission, and it mainly does this through utilizing spores to get through and attack its host. So the mechanism of transmission here is the toxin binds to the presynaptic nerve terminals and it attacks the snare proteins. So the mechanisms that the snare proteins use, it stops the release of acetylcholine when it is cut, and then this stops the process of the muscles being able to contract. So it results in flaccid paralysis where your muscles cannot move, and this is where all the symptoms begin in the neuromuscular junction targeting. The sneakiness of botulism does not end there. This toxin is shielded by a protein complex that protects it against the digestive enzymes and stomach acids, so it is able to survive in the gut. So the endospores add another layer of defense to the botulism, so it makes it nearly indestructible under typical conditions. Altogether, botulism is a masterclass in invasion and destruction, making an early intervention crucial to stop its progress. Clinical evaluation is the next part of this, and so it starts with a physical exam where they're going to be looking at the symptoms that you are displaying and if they closely match what botulism typically looks like. So they're going to ask if you have any weakness in your body, if you have dry mouth, if you're experiencing double vision, or if you're having any difficulty speaking or even swallowing. So they will look at this disease and see, like, are you matching these symptoms, or could it possibly something else that has similar symptoms to botulism, like a heavy metal poisoning or possibly even a stroke? So basically this is the stage where they're just ruling out what it could and could not be, since a lot of them have the same symptoms. So then they are going to look at patient history, and they're going to ask you questions about what you've eaten recently, if you've eaten any like canned goods or fermented foods. They're also going to look and see if you have any wounds on your body, see if they're maybe infected, because maybe it could come through that. This also involves asking when your symptoms started, because wound botulism and infant botulism have the same timeline, but foodborne doesn't. Foodborne happens a lot quicker, between like 6 and 36 hours after you've consumed the contaminated food, but wound and infant botulism can take a couple days to infect you. So in this part, they're going to be looking at like what is going on and if it is going to be like a certain stage of botulism. And then the last thing they're going to do is do supportive testing. So this is the laboratory testing, and it can help them confirm if it's botulism or not. So they do this through looking if there's like the toxin, Clostridium botulinum, in your body. They're going to look at this either through testing your blood or in your stools. Either way works, but they're going to look through it there. And they also can do EMG testing, which is an electric activity tester, where it sees how much electric activity is in your muscles. And if it's like lower than it typically is or what it should be, then that could be a sign of botulism, because low response and stimulation is what occurs during botulism. When you are treating botulism, you treat it like it is a medical emergency. So you seek care from a medical professional immediately in case it is much more severe than it is right now, or it could get worse. And so they're gonna give you an antitoxin that neutralizes the toxins that are in your body. It doesn't do anything to reverse the paralysis that has already occurred. That's going to take a little bit longer. It does get better over time. It's not instant. And it's mostly just from your body naturally getting your muscles back in order and just going back to its normal bodily processes. So another treatment kind is using like a ventilator if you are really having like bad respiratory compromisation. They also could give you like IV fluids or other feeding methods like G-tube if you can't swallow because of the progression. And they also may make you take activated charcoal so you throw the rest of the toxins out. So the best way to make sure you don't get caught with this sneaky disease is prevention. So this looks different through the different kinds of botulism. In foodborne botulism, you're going to want to be very cautious with the food you're eating. You're going to make sure you're following the instructions on the label. If it says to refrigerate after open, you're going to refrigerate it after opening. And then you're also not going to want to eat from foods or from cans that have been dented or are bulging because it could have botulism in there. It's a sign of it. And also when you're making homemade cans, you're going to need to boil the cans or the jars for 10 minutes before you start doing anything else with it because you need to kill off that bad bacteria. Wound botulism prevention is basically just keeping your wounds clean. You're going to make sure there's no dirt or grime on it. And if it starts to look infected, please go to a doctor. They're going to help you because it's better to take care of it right then and there. In infant botulism, the main way is to not give babies honey because they don't develop the bacteria that can protect them against botulism until they're a year old. And honey is like the main way that everywhere says that this occurs. So make sure you're not giving your babies botulism through honey. For latrogenic, make sure your injector is legit. So if you have any doubts, maybe just stick this one out. Going to a non-licensed injector can lead them to giving you the wrong dosage, and it could lead to unsafe situations. So trust your injector and make sure that you're staying safe. Today we learned about botulism and that it's a disease called Clostridium botulinum, and it works by blocking the acetylcholine release in the neuromuscular junction, which causes the scary paralysis in your body. We learned about the 4 types of botulism, how they transpire, and how you can prevent it. Caution is good when it comes to botulism, so trust your gut in these situations. Thank you for watching Crash Course. Stay safe, stay curious, and always double check that canned food. See you next time.